Hi, everyone. I'm Stella at Flourish Ventures, and as Ashley said, I lead our work in strategy and insights, which also includes measurement. And I have to say, it's been so exciting to be here these last 2 days. I've never been in a room with 200 people who are as excited about financial health and as excited about measurement. I'm usually the only one in the room. So thank you very much for being here, and a huge thanks to the Financial Health Network. At Flourish, we're huge supporters. And I'm very excited to be here today to talk about how, not just how we measure financial health at a national level, but how we bring that to an individual company level. So how we're each measuring our employees' financial wellness, or our constituents or kind of customers' financial wellness, and how that impacts our work. So I'm joined today by 3 experts in this field. Rachel Korberg, Executive Director at the Families and Workers Fund, and she works on helping employers think about what good jobs look like for them and to commit to supporting good jobs. I'm with Usman Ahmed, who leads PayPal's work in global affairs and research and works closely on PayPal's efforts to support employee financial health. And Corinne Chu from Habitat for Humanity, where she's running impact measurement across, I think it's 1,000 or more affiliates across the US, on how they can measure the financial health of the homeowners that they're serving. So thank you so much for being here today.
Thanks.
So I wanted to start off with how you each got to where you are in your organizations, and what that looks like, what financial health looks like for you. I think I've heard just in conversations a lot of folks talking about good jobs, and so I'd love to start there. But before we do, we were wondering, we wanted to get a sense kind of where everyone in this audience is in their journeys on financial health measurement. So at your organizations, by show of hands, let's start with who is just getting started in this journey? Okay, handful of folks. And who's been doing this for a year or more at your company? So we've got some folks who have quite a bit of experience. We'll try to tailor our conversation to that. I also wanted to ask, who here is primarily a user of data versus the ones who are kind of collecting and tracking? So who here is primarily receiving data around financial health and using that? A lot of folks. And are there folks here who are collecting and tracking financial health data primarily? A handful. Because I wanted to get into like a really kind of nitty-gritty discussion of how you measure what that looks like, but we'll try to keep this appealing and interesting to all. So with that, I'd love to start by, Rachel, with you talking about what good jobs look like for you.
Yeah, well, first of all, thanks so much for having me here. Can everyone hear me okay? All right, good. So I run the Families and Workers Fund, and we are a philanthropic pooled fund. We do grants that work to advance uplifting careers for everyone. And it was interesting, you know, after the pandemic and as our labor market started to tighten, so many of us were thinking a lot about workers and the experience of going to work. I think it was something that we were all acutely aware of in a different way during COVID. Who were the people who were ensuring that, you know, our groceries got delivered, and that our parents and children were cared for, and that our, you know, prescription drugs reached all of us? So there was this way of thinking about work and what makes a good quality job that just was a lot more front of mind. It wasn't only for people who are really focused on employee financial health, as we are in this room. So there was that, there was this tight labor market. And really, all of a sudden, over the last couple of years, there was this outpouring of interest in how do we actually define and measure a job that enables the person in it, the worker, to be financially healthy. You know, what makes a job good? So we dove into this. We partnered with the Aspen Institute on it. And we brought together a group of very diverse leaders from the Fortune 500, from policy shops, from labor unions. We dug deep into the research, and then we tested all of this with business owners, with the C-suite, and with frontline workers themselves, very importantly. And what we ultimately put out was called the Good Jobs Champion Statement. It's been signed by 250 different leaders, companies, organizations, so it's the most broadly shared and endorsed definition of what makes a good job. And it's actually pretty simple where we landed. So it's essentially 3 parts. A good job enables you to get by, get ahead, and have a say. Or to put it in slightly more technical terms, and you can check this out online and look at the indicators, a good job should provide economic security, so that core baseline, right? It should also provide you with access to economic mobility, so that opportunity for progression, for wealth building, career advancement, training, and then also equity, respect, and voice. And this is something we heard actually from people who are in jobs that we would say, you know, hey, that's a great six-figure salary, a strong benefits package, that's the American dream. And yet there were still these challenges around really feeling that you were being seen in the workplace, that you were empowered to solve problems, that you could really bring your full, innovative, productive self to the workplace. So, you know, I'll stop there, but I'm happy to share more.
Thanks, Rachel. And I think that's a great segue to Usman. PayPal is one of the leaders in thinking about financial health for employees, and would love to hear more about that.
Yeah, thank you, and thank you to FHN for inviting us and me to speak on this topic. Our story goes back really to probably 2018, when we did a kind of a standard corporate survey of our employees, where we ask all sorts of questions about how you're feeling at work, how you're feeling about your manager, all those kinds of questions. But that year we decided to add a couple. We had been actually engaging quite a bit with FHN and had decided to add a couple of questions about financial health. And the results were pretty shocking, frankly. Given that the company's mission was to democratize financial services, improve financial health, what we found was that 60% of our customer service and hourly employees were struggling to make ends meet. And so that was, you know, delivered, that message was delivered directly to the C-suite as, you know, a pretty big challenge. And what was amazing was that the C-suite responded, really from our CEO, Dan Schulman, on down, just a commitment to help to resolve this issue. And so we put together a comprehensive program in 2019. We called it the Employee Financial Wellness Initiative, and it had increased wages, made everybody an equity owner of the company, you know, renegotiated our healthcare benefits for our employees to lower those by, you know, 50, 60% and sometimes, and to kind of wrap all of that up in a financial planning kind of support system. And the last thing I'll say on kind of the strategy and the approach was, it was driven by measurement. It was really informed by good data about our employees. And as we progressed, we kind of have set out a metric that, you know, we're kind of aspiring to, which was when we did the initial 2019, we did another survey to estimate, and we really dove deep into all of our employees and tried to understand their expenses. And we found that not just, you know, being able to get by, as you said, but really being able to plan for the future, you know, protect against shocks. We created this metric called the net disposable income method. So not just that you can make ends meet, but that you're actually saving some for the future. And that when we did our initial assessment, it was only at 6%. 6% net disposable income after all your expenses are paid. And we set this goal of getting to 20%, and in 2022 we exceeded that, and we continue to kind of measure it going forward.
That's fantastic. Corinne, I want to move to you. At Habitat, you are tracking financial wellness for your homeowners, and I'd love to hear about how you're thinking about that. I know you've just started piloting the program.
Sure, thanks, Stella. So I just found out that we are all parents of toddlers, and I also feel like we are in the toddlerhood phase of measurement for financial health at Habitat for Humanity. So we're an affiliated network, and we have over 1,000 affiliates throughout our network. And our primary goals are to build, finance, and preserve affordable homeownership for households that are in the 30 to 80% area median income range. And so some of the things on our team was formed a little over 5 years ago, research and measurement, to really think about how we prove and improve outcomes across the US network. And so some of the things that we're doing are really focusing on how can we measure things locally in a way that's consistent nationally, and we're looking at different types of outcomes as well. So not only financial health of our homeowners as they move into their homes, but we're looking at changes in physical health, changes in mental health, and changes in educational outcomes. And we came to the Financial Health Network about a couple years ago. We've just become members a little while ago, and we're starting to use the FinHealth score and leverage some of the pulse data in our work as well.
I want to ask you a follow-up, and this gets to a bigger question for all three of you around leadership buy-in. But Corinne, you and I had talked about this move from outputs to outcomes. And I'd love to hear a little bit more about how you made that transition, how you got leadership buy-in around that idea, and affiliate buy-in, because you're working with so many different stakeholders.
Yeah, thank you, Stella. So a couple of different things. Our team was formed at the request of the affiliate network about 5.5 years ago. We polled affiliates and asked, well, what's really going to move the needle across the network in our work? And one of the things that they mentioned was research and measurement. They really wanted to be able to better prove and improve the work that we do. So one of the ways that we've been doing that is listening to affiliates and listening to homeowners and thinking about what are those outcomes that we want to be accountable for and what are the best ways to capture that. And so we're working on developing and piloting different household surveys right now that include the FinHealth score as well as some of the other metrics that I was talking about earlier, and then are also thinking about how do we share that information back to affiliates so that they can make decisions across their portfolio to improve the services that they're providing, like financial counseling or connecting affiliates or homeowners to additional resources. And the leadership buy-in piece really came from the affiliate network at first, and then also we've had quite a bit of buy-in both at the VP level as well as with our IT colleagues, because we're implementing a new technology to be able to track this information longitudinally.
I want to ask the two of you also about this. How do you get senior leaders, employers, to be excited about this idea and really bought into it?
Please.
Well, we're looking at one of the companies who's done this in such an inspiring way, so I'm looking forward to hearing your answer. I would say two things. The first is there is a very strong and compelling business case for this, and we all know that or we wouldn't be in this room, right? But when our workforce is engaged, is productive, is not coming into work thinking, oh my gosh, is my kid okay? Or wow, I've got car troubles and I can't afford to deal with them. Like, we're all gonna be able to actually show up and do our best work. And this is very clear with companies that have really centered this employee financial wellness strategy. So I would say, even making that inclusive of financial wellness, but expanding it to what I was sharing around also economic mobility, these training and advancement pathways, thinking about equity, how you really bring all of that together into this really strong employee experience just has huge, clear returns to your bottom line as a business. I have seen companies do this in very specific, concrete ways if they're not fully bought in, because sometimes it can feel too mushy, right? And there's a lot of pressure, especially in low-margin industries. So, I'll mention one apparel company that had their most important goal that they were working on was actually reducing waste at that time in their production process. And what they realized was actually they weren't having a waste problem, they were having a workforce wellness problem. And by making a number of changes around training, around health and safety, also around looking at the total compensation package, they actually were able to reduce their waste in the production process. So really thinking about how do you bring this framework to other goals you may have in your company, including those that have very clear, direct bottom line impacts. So that's the first thing is like, what's your business case? Sometimes I think we can talk about this in some high level way, but like for you, for your unit, for your company, what is the specific concrete value of this? And there will be one, but getting really clear on that I think can help. And I've seen that really move the needle, like with this apparel company that sort of thought, this feels a little wishy-washy, no, now this is something real. And the second I would say is the heart piece. The truth is in most of these stories where there's a really significant and transformative shift when it comes to financial health measurement of your workforce, there was a leader, usually in the C-suite, who said, hey, I want my leadership story to be different. I want to really know that the people in this company are well supported, I want this to be something key to my legacy. And I have found, for the CEOs and other C-suite leaders that go through a big process similar to the one that we saw at PayPal, it's the thing they're going to be most proud of. It's what they're going to be talking about at the Thanksgiving table with their grandkids, for the rest of their lives. So there is that piece of it. I wish I could say it's just pure dollars and cents, but I usually find it's the interplay of those two things, of being a good person and the business case.
Absolutely. I really appreciate your response, Rachel, because this notion of leaning into whatever the mission of that company is, there's always going to be some way where you can align this kind of work to that. People are coming to work for that company because of the mission.
Yeah.
The C-suite is obviously coming to work because of that mission. And so if you can align this with that, and that was easy in our case, right? Our mission was exactly this, but I think your point about sustainability and, developing a great product, there's employees are the ones who develop the product. So there's always a way, and I think it's absolutely the right approach to have that high level. How do we get into the broader mission of the company through this initiative? The other thing I'll just go back to is measurement. I mentioned that kind of the start of this was because we did this measurement, we were able to demonstrate that this was something that was impacting our employees. And as we've carried through, and this is a thing that I think cuts across every company, is retention. Measuring the impact that this has on retention. We were able to very clearly demonstrate, prior to enacting this, our company was pretty much standard for these kinds of jobs, which is 20% almost turnover in entry level and kind of customer service jobs. It's just kind of the industry standard. And after we initiated this initiative, it went down to 7%. So that's huge, because that's millions of dollars that people are spending retraining people and doing exit packages and doing entry stuff. I mean, that's all being returned to the company, plus the employees are going to be better because they've been there, they're dedicated, they know what they're doing. So there's very tangible, concrete benefits that every company, regardless of the mission, I think could also benefit from.
I personally find this so exciting, and I think being able to tie an objective to tangible outcome measures to business success measures is incredibly powerful and something to be celebrated. I also measure financial well-being, financial health at my organization. We invest in fintech startups, some of whom are in the room. And I think there's a couple challenges that we face, and I think some of you've mentioned as well when we've chatted. One is kind of how you collect data, and sometimes that can put an undue burden on the end employee, or there could, there's many challenges around what you collect and how you collect it. And I think the other side is how that data informs business decisions. And so I'd love to hear kind of on those 2 points, how you think about collecting data and then using it.
Sure. So the way that we are collecting data now, we're running several pilots, and we have pilots for specific grant-related opportunities, and we're also conducting a statewide pilot right now. I mentioned before, we're testing out a new technology solution, so we're implementing within a Salesforce environment a longitudinal way to track homeowner and repair household, financial health, and other outcomes over time. And what we're really trying to do is ease the burden on our affiliates. So we're automating reminders, we're automating the post-registration of a household process to all be email focused directly to the homeowners. We're also looking at providing some supports for paper-based surveys and for phone surveys as well, because we know we have a large older adult population that would prefer to do the surveys in a different method, and so we need to provide additional support there. And then we also have worked with our homeowner leadership group to understand how long surveys should be, what the user experience is like, and what kinds of incentives would be most meaningful in order to participate both in the front end at a baseline or to follow up at different points along the way, so that we can gather the correct insights but also honor the folks who are taking the time to provide that information.
Yeah, a couple of thoughts. So when it comes to measurement, one of the things I loved about your story, Usman, is yes, you all are measuring net disposable income, right? And you're looking at progress and when do you get to that 20%? But you're also looking at the knock-on effects, the why. And I think sometimes we forget to pick some outcomes around the why that would help us measure, did our theory of change here actually play out, right? So you looked at retention, and that's a really major one that we hear from companies we work with right now, especially in this moment of a historic labor shortage, this very tight labor market, the war for talent. So I would definitely encourage you, if you're not already, to think about some metrics that would show you, is the knock-on effect happening? Is this actually delivering value to your business versus just, are you making progress towards those financial health targets along the way? So that would sort of be the first part. And then the second thing around measurement is making the sort of how you deal with the measurement when you're talking about the workforce, I find is almost as important as what you're measuring. So for example, say you are a company that's really comfortable with quantitative measures and you do a lot of, whether it's pulse surveys or pulling data from your payroll system. I'm guessing that this is a room that is the best in class when it comes to this kind of data and utilizing it, right? Just as important, I think, is how are you actually bringing that data into a conversation with your workforce so they can actually interact with it, talk about, what concerns them, what doesn't, what is an area for improvement, what's an area of pride. That's the piece that I think, say you don't pick the right metrics or you only can pick 3 in a given year, and I hear a lot of times executives stressing about that. I know my workforce wants to see me measure these 50 things, but we just can't do it all. I truly think that if you can just pick a few, but you engage with folks around them in the right way, you actually get more value out of it, and it can do more for getting those effects of employee engagement and productivity.
So I know I've talked a lot about kind of quantitative measurement, which is certainly something me, my team, and the company are very dedicated to, but I also want to highlight qualitative. There are certain things that get lost in the data. And when you're talking about people, employees, their financial lives, there's things that are deeper than what the data show you often. So we were really lucky, again, having engaged with Financial Health Network and having a CEO who was really committed to this. He was commissioned a financial diaries project. So we, not me or my team for privacy reasons, we hired an outside academic who was actually one of the co-authors of the original Portfolios of the Poor and Financial Diaries, to follow 20 of our employees for 18 months and really understand the impacts and the shortcomings, frankly, of the program that we set up. And what we were able to learn through that not only went back into just small tweaks and changes to the actual overall program, but just a huge learning that I think, encourage you all to read it. It's, it's online if you want to look this up and if you're interested in this space. But the biggest insight I think from that was that it wasn't even the individual salary increases or the equity. It was the fact that it was the organization had made this comfortable to be engaged in. So employees by themselves and managers, we've talked a lot about C-suite and we've talked a lot about employees, but managers, middle and senior, middle out of this is incredibly important. We saw managers, or we heard about managers who were encouraging their team members to kind of bring their financial lives to work and talk about their problems and talk about, hey, this is the first time you've ever owned equity. Are you do you have any questions about it? Or what are you doing? And people felt comfortable talking about that with people who were similarly situated. It might be nice for some C-suite person to say, this is something that you now have, but they're probably not going to ask questions directly on that. But if every employee around them is getting the same benefit and is dealing with the same kind of issues, lives in the same place, is part of their community, and you make it comfortable and kind of commonplace to discuss this kind of thing at work, you see incredible kind of knock-on benefits to just the monetary or even healthcare benefits that came to play. So I definitely want to encourage anybody who's thinking of doing this to surround some of the quantitative with some qualitative measurement, because you get super interesting insights that you never would get just from the surveys.
I think that's hugely powerful, and I love that you're also bringing up the power of data to help shape narratives and build narratives and establish, kind of live the values of your company too. Fantastic. I want to take this one step further, and if you're comfortable sharing, can you give specific instances of where data has led to learnings that have changed your program over time? And Usman, I'm looking at you in part because I think you're furthest along in this journey.
Sure. So I mentioned everybody became an equity grant owner. Traditionally, those equity grants were provided on an annual basis, which is just kind of commonplace in the tech and broader industry. They're often used for retention, as you can imagine. But given that these were often employees, again, with what our survey showed is that that kind of savings needed to be used for a flat tire or a healthcare issue, and so waiting until June, I can't do that. So we moved to quarterly vesting of our equity earnings based upon the feedback that we were getting about annualized equity. So that's just one example, and certainly on the healthcare front, we've learned a lot. That's certainly a very challenging ecosystem, but it's constant. It's just a constant feedback loop, and we're constantly trying to update this program to meet the needs.
Yeah. And Corinne, I know you're still relatively early. Do you have examples from your affiliates on sort of how they're trying to use this data to inform their decisions?
Yeah, a couple of examples. So one of the things that we're working on right now are building out some dashboards to be able to share this information easily with affiliates and for them to be able to filter by time and slice and dice by geography, by demographics. Some of the things that we're doing now with regard to the financial health score and looking at some of the trends in the data, we've just started capturing data prior to a repair on a home and then about 3 to 6 months after, and we're looking at changes in financial health and other outcomes. And the financial health scores for spending and saving have actually improved for repair households. And so thinking about, well, where are there opportunities for us to learn more and dig deeper into where there might be inequities in the kinds of outcomes that we're seeing in different subgroups of populations that we're serving, or where can we provide additional support? We provide financial counseling on the pre-purchase side for home ownership, but we don't provide or very rarely provide it for home repairs. And so there is potentially an opportunity there to work with our older adults or other groups that we're typically doing a lot more repair work, but may not be serving financially or through financial counseling in that way. And so it's an opportunity for us to just dig a little bit deeper and see where we might be able to provide some more holistic support.
I want to ask you a little bit more about what you see going forward. So I think you're at different stages, but very, very involved with financial health measurement. And what are you excited about at your own organizations and the industry more broadly?
Sure, I'm happy to start. I think we're really seeing a race to the top when it comes to financial health measurement and when it comes to sort of the definition and measurement of good jobs. So, the example of this is over the last few years, we are now at a place where there are at least 3, but I think more, rankings indices for companies based on the quality of the jobs that they provide. So we've got one with Fortune. I'm on the advisory group for a new one from US News and World Report. Just Capital has a fantastic one. Essentially what we're seeing as getting back to the war for talent is you're seeing employees really consider their options when it comes to, we've all always considered what's the pay, what's the benefits, what's the work environment. But essentially what we're seeing now is this way of using data around workforce, financial health, and job quality to compare companies in a very public way, actually. And I think that the good flywheel effect of that is companies actually want to tell their own stories, right? They don't just want to be thrown on these, ranking indices. Maybe they don't agree with where they are. And that then compels companies to go and do this measurement more deeply and be able to tell their own story. So, that plus, I know we're all aware of the growing interest around human capital disclosures and much greater data that is already being shared and much more that will likely be required in the future. I really think we are in this moment where we're actually just going to know a lot more about people who are in the workforce about what their financial health and wellness is. And I think that's great for all of us. That's really exciting.
So certainly at the company, as I just mentioned, we're constantly kind of trying to evolve this program and we just had another kind of pulse survey where we'll get some new data and try to understand where folks are and what the needs are. But what I'm most excited about is, about 2 years ago, PayPal, we realized that we have 30,000 employees. So this is meaningful. This is a lot of people who are getting impacted by this, but overall, that's a very, very small percentage of the labor force in the private sector. And so we partnered with FHN and with MIT Good Jobs Institute and with Just Capital, and thanks to funding from the Families and Workers Fund and others, we've been able to create this project called the Worker Financial Wellness Initiative, where any organization can come and join. And it's not do the PayPal program or this list of things you have to do to kind of be part of this. Rather, it's really that first phase that we that we were in and that we're still in, which is measurement. And it's really about encouraging other organizations to make this commitment to try to at least understand and measure in a concrete way your employees' financial wellness. And we've seen, some big companies, Verizon, Chobani, Chipotle, join in, which is really, really exciting. But I think, as you mentioned, there's these macro factors where we're at the cusp of this issue really becoming kind of pervasive. So I'm really, really excited and hopeful. And if anybody in the room is interested, just Google worker financial wellness or email me or email pretty much anybody at PayPal, and we'd be happy, or FHN or Just Capital, or we'd be happy to engage with you, because I really think this becoming a movement is really, really exciting for the future.
Great.
Thanks. So I'm excited about digging into our pilots, learning more about how others measure financial health and incorporate that into their work, and then also the intersectionality of financial health with other sectors like affordable housing, health, climate, and more. And so I think just the opportunity to learn and share, and seeing how maybe we can integrate the data that we're collecting together to collectively have a better understanding of financial health for the populations we serve.
I think this conference, there's a big theme around taking data and moving it to action. I think all three of you have done a phenomenal job of that. And I think another theme that's coming out here is around narrative building and collaboration. So sharing what you're learning with your employees or your constituents, sharing what you're learning with others in this space. And so thank you so much for being here. I have one final question before we wrap up, and it's really just broadly for this group. What advice would you have for those who are early in their journey, further along? What learnings have you found, and what words do you have for us?
Corinne, please.
Okay. I think for us, taking the time to co-design and co-develop with different stakeholders who are going to ultimately be the folks who you're collecting data from or with, as well as the folks who are going to be the decision makers, and co-designing that process, making sure that it is a manageable amount of questions and is a good user experience, and then start small and pilot and iterate. I think that's been really helpful for us. We've tested and modified our approach several times, and we're doing the same thing for data collection as well as data visualization.
Mm-hmm.
Please.
I will piggyback on that. So my big piece of advice would be to bring together a group of your users, whether those are employees in your company or customers, but to do that not just on the front end, which I know folks are doing, and we have a number of people at this conference who are really leaders in user testing and have done really groundbreaking work there. But I think the key is to actually have that group travel with you throughout the process of doing deeper financial health or good jobs measurement. So from the beginning, like working with them to really identify which metrics are most important, what kind of qualitative data you're going to want to bring in as well, being able to really travel along so that they can be part of like the sense making and the interpretation that we so often just kind of do within our own companies. And then at the final stage, the so what, right? So what are we actually doing with this information? What are the things that you would ask of us, changes that we might make as a result? And I think just beginning that conversation is so key and can really lead to some pretty extraordinary and surprising outcomes.
I love what you said, Corinne, about starting small. I think that's so important in finding, if you're a large organization with many, hundreds of thousands of employees, trying to grab all of that and solve all of that is probably not the best approach, right? Find a city, find an office that you can start with and really start to implement and measure some of these things, and then you can show gradually, like, look, this is what happened to that office as a result of implementing these relatively small things. And then you can get that buy-in from more and more senior levels to hopefully implement it on a much broader level. And the last thing I'd just say is now is the time for this. Like, as you mentioned, the tight labor market, the macroeconomic factors, and that there's political, this is an issue that politically I think has a lot of support, improving the lives of the workers in America is something that very few people are against, I think. And so there's an opportunity there for everybody in this room, I think, for government, for nonprofit, and for private sector to be able to really move on this together.
That's it for today. Usman, Rachel, Corinne, thank you again so very much. This is just so much fun to speak with you today. And a big thanks again to the Financial Health Network. And I know we don't really have time for questions, I'm looking to see, but do grab these folks after this session because I know there's probably a lot more tactical things to dig into. So thank you very much.
Thank you.
Thank you.